So my name's Shayne Dearling, so I'm the Senior Manager for TELUS Health for all of their counselling services. So I'm a psychologist by background. My background's in organisation psychology, and I've worked a lot in clinical psychology. So I manage all of the counselling services across the APAC region. So I've come to the Digital Health Festival today to give a presentation on one of the key surveys that TELUS Health does globally. So it's called the Mental Health Index. And what that does is it gives a baseline measure of the mental health status of the current workforce within Australia and across the globe. So we surveyed 15,000 different people.
Wow.
We had a baseline measure of how people are going with that overall psychological health within the workplace. That information can then be utilised by workplaces to inform what targeted interventions they would like to do. So our organisation can create targeted interventions based on the data that we've collected in that potential, so in that industry. So we also break it down to particular industries. So say it's food and beverage industry, for instance. We have data on those industries, so we can target interventions based on that.
Wow, really fascinating stuff. I mean, obviously we could talk about this for hours, but I mean, at a high level, are there any sort of key takeaways or trends that you're seeing in your data that your listeners might find interesting?
Good question. Thanks, Nathan. As I presented this morning, interestingly, we started collecting this data in 2020, in April 2020. So that was the height of the COVID period. So we have baseline data of what people's mental health index was at that point in time.
Sure.
And the interesting and somewhat disappointing fact is that people's mental health index is more or less back at that same level as to what it was at the height of the pandemic. So a takeaway message is for people that we still need to focus really strongly on our mental health and ensure that we're doing the things to meet our population where they want to be met. Younger workers, for instance, they are asking within their contracts that they have mental health days to support their well-being. Organisations need to look at these things in order to attract the right talent. And then we have to offer a variety of different modalities for people to access. One of the interesting statistics that we have out of North America is that 63% of people that accessed our services via the live chat, so a technology-based platform, either via our app or via a computer, stated that they would not have accessed clinical support if they didn't have that option. So we need to focus on other forms of delivering service, but also at the same time, we need to remain focused. There's a large proportion of the population that want face-to-face services.